Alright everyone, welcome back to the channel. Today we're tackling a topic that affects millions of people around the globe, and it's something every future healthcare professional needs to understand inside and out. We're talking about allergies and hypersensitivity reactions. It's a subject that can seem incredibly complex at first glance, with all its talk of immunoglobulins, mast cells, and cytokines. But my goal today is to break it all down for you. We're going to strip away the jargon and get to the core of what's happening in the body when it has an allergic reaction. This guide is for all of you, medical students, nursing students, and anyone in the allied health fields. Think of this as your foundational guide. We'll start with the absolute basics. What is an allergy? From there, we'll look at the common culprits, the allergens that trigger these reactions, from the pollen that makes your eyes water to the peanut in a chocolate bar. We'll explore how these troublemakers get into your system and what happens once they're there. Understanding the pathway is key to understanding the patient's experience. It's not just about memorizing facts for an exam. It's about building empathy and a deeper clinical understanding of what your future patients are going through on a daily basis. We're going to go deep, but we'll keep it simple and clear. I'll walk you through the different types of hypersensitivity reactions, all 5 of them. Yes, 5. Many textbooks still focus on 4, but we'll cover the more modern classification. We'll use easy-to-understand examples for each type, so you can connect the theory to real-world clinical scenarios you're likely to encounter. I've also included some simple diagrams to help you visualize these complex cellular processes. Visual aids can make all the difference when you're trying to grasp how these immune pathways work. So grab your notebook, get comfortable, and let's get into it. This is essential knowledge that will serve you throughout your entire career. We're aiming for clarity, not complexity. And just a reminder for everyone watching, we have subtitles available in multiple languages to make this content as accessible as possible. Let's begin our journey into the fascinating world of the immune system's over-enthusiastic responses. By the end of this, you'll have a solid framework for understanding, diagnosing, and managing allergic conditions. Let's do this. So what is an allergy? In the simplest terms, an allergy is an overreaction of your body's immune system to a substance that is normally harmless to most people. Think of your immune system as your body's personal security team. Its job is to identify and neutralize genuine threats like bacteria, viruses, and other pathogens. It's an incredibly sophisticated defense mechanism that keeps you healthy. However, in the case of an allergy, this security team makes a mistake. It misidentifies a harmless substance, like pollen or dust, as a dangerous invader. This substance is what we call an allergen. Once the immune system has flagged an allergen as a threat, it prepares to attack it every time it enters the body. This is a process called sensitization. The first time you're exposed to an allergen, you might not have any reaction at all. But behind the scenes, your immune system is taking notes. It produces specific antibodies called immunoglobulin E or IgE. These IgE antibodies then attach themselves to the surface of certain immune cells, primarily mast cells and basophils, which are stationed in your tissues, like your skin, airways, and gut. Now, these mast cells are essentially primed and waiting. They are like loaded cannons, ready to fire at a moment's notice. The next time you encounter that same allergen, it binds to the IgE antibodies sitting on these mast cells. This binding acts as a trigger, causing the mast cells to degranulate. This is a fancy way of saying they release a flood of powerful chemicals, including histamine, into the surrounding tissues. It's these chemicals that are responsible for all the classic symptoms of an allergic reaction. Think about it. Histamine causes blood vessels to dilate and become leaky, leading to swelling and redness. It stimulates nerves, causing itching. It increases mucus production, giving you a runny nose and watery eyes. It can also cause smooth muscles, like those in your airways, to contract, which can lead to difficulty breathing. So an allergy isn't a sign of a weak immune system, quite the opposite. It's an immune system that's working overtime, but unfortunately, it's directing its powerful arsenal against a false alarm, causing a lot of collateral damage in the process. Now that we understand the basic mechanism, let's look at how these reactions manifest in the real world. Allergic conditions can affect different parts of the body and range from being mildly annoying to life-threatening. One of the most common is allergic rhinitis, better known as hay fever. This is typically triggered by airborne allergens like pollen, mold spores, or dust mites. The release of histamine in the nasal passages leads to that classic trio of symptoms: sneezing, a runny or stuffy nose, and itchy, watery eyes. For many people, this is a seasonal misery, but for others, it can be a year-round problem. Another major one is asthma. While not all asthma is allergic, a huge percentage of it is. In allergic asthma, when a person inhales a trigger, like pollen, pet dander, or dust mites, the immune response doesn't just stay in the nose, it goes deeper into the lungs. The histamine and other chemicals cause the lining of the airways to swell, the muscles around the airways to tighten, and an overproduction of mucus. This combination narrows the airways, making it incredibly difficult to breathe, leading to coughing, wheezing, and shortness of breath. It's a serious condition that requires careful management. Then we have food allergies. These occur when the immune system mistakenly targets a protein in a particular food. Common culprits include peanuts, tree nuts, milk, eggs, soy, and shellfish. The reactions can vary widely. Some people might experience mild symptoms like hives, itchy red welts on the skin, tingling in the mouth, or an upset stomach. However, for others, food allergies can trigger a severe, life-threatening reaction called anaphylaxis, which we'll discuss in more detail later. It's a systemic reaction that can cause blood pressure to drop dangerously and airways to swell shut. Finally, let's touch on atopic dermatitis, also known as eczema. This is a chronic, inflammatory skin condition that often has an allergic component, especially in children. It causes the skin to become red, dry, itchy, and cracked. While the exact cause is complex, it's linked to a combination of genetic factors, like a leaky skin barrier, and an overactive immune response to environmental triggers. These triggers can include allergens like dust mites and certain foods, but also irritants like soaps and detergents. Managing eczema involves not just treating the skin, but also identifying and avoiding these specific triggers. We've mentioned the word allergen a lot, so let's officially define it and look at the usual suspects. An allergen is any substance that can trigger an allergic reaction. Technically, it's a type of antigen that prompts a hypersensitivity response. These substances are all around us in our daily environment, and for most people, they are completely harmless. The problem, as we've established, lies not with the substance itself, but with how an individual's immune system perceives it. Let's break down the most common categories of allergens you'll encounter in your practice. First up are the inhalant allergens, the ones you breathe in. Pollen is a huge one. Trees, grasses, and weeds release these tiny grains to fertilize other plants, and for allergy sufferers, they are a major source of seasonal misery, causing hay fever and triggering asthma. Then there are perennial or year-round indoor allergens. Dust mites are microscopic creatures that live in our bedding, carpets, and upholstery, feeding on dead skin cells. It's not the mites themselves, but their waste products that are the potent allergen. Animal dander, which is tiny flecks of skin, saliva, and urine from pets like cats and dogs, and mold spores are other common indoor culprits. Next, we have food allergens. While a person can be allergic to almost any food, there are 8 major food allergens that account for about 90% of all food-related allergic reactions. In the UK and Europe, this list is often expanded to 14. The most common ones to be aware of are milk, eggs, peanuts, tree nuts like walnuts and almonds, soy, wheat, fish, and shellfish. The proteins within these foods are what the immune system mistakenly identifies as a threat, launching an attack that can range from a mild rash to a full-blown systemic emergency. Then we have allergens from insect stings. For most people, a bee or wasp sting is just a painful, localized nuisance. But for those with an insect venom allergy, it can be deadly. The venom injected during a sting contains proteins that can trigger a rapid and severe systemic reaction, known as anaphylaxis. This is a true medical emergency. Similarly, some people can have significant allergic reactions to insect bites, for example from certain types of mosquitoes, but venom allergies are typically the most severe and concerning for us as clinicians. Finally, we have to consider medicines. Drug allergies are another important category. While any medicine can potentially cause an allergic reaction, some are more commonly implicated than others. Penicillin and other related antibiotics are probably the most well-known example. Other drugs that frequently cause allergic reactions include aspirin and other non-steroidal anti-inflammatory drugs, chemotherapy drugs, and anesthetics. It's crucial to always ask patients about drug allergies before prescribing or administering any medication, as the consequences can be severe. An allergen can't cause a reaction unless it gets into your body and comes into contact with your immune system. There are four main ways this can happen, and the route of entry often influences the type of symptoms a person experiences. Understanding these pathways is crucial for diagnosing allergies and advising patients on avoidance strategies. The first and perhaps most common route is inhalation. This is when you breathe in airborne allergens. As we discussed, this includes things like pollen from plants, microscopic dust mites from your pillow, mold spores from damp areas, and dander from your pets. When these allergens are inhaled, they come into direct contact with the mucous membranes lining your nose, throat, and lungs. This is prime territory for mast cells, which are waiting and ready to react. This direct contact is why inhaled allergens typically cause respiratory symptoms. You see the classic signs of hay fever, like sneezing and a runny nose, or the wheezing and coughing associated with allergic asthma. The reaction is localized to the respiratory tract because that's where the exposure happened. It's a direct cause and effect relationship based on the point of entry. The second major route is ingestion. This is when you eat or drink something containing an allergen. This is the pathway for all food allergies. When the food is digested, the allergenic proteins are absorbed into the bloodstream through the gut wall and then circulated throughout the body. Because the allergen is distributed systemically, the symptoms can appear in many different places. A person might get hives on their skin, swelling of the lips and tongue, stomach cramps and vomiting, or even respiratory symptoms like wheezing, as the allergen reaches mast cells in different tissues. This systemic distribution is why food allergies can be so dangerous and unpredictable. The third route is direct skin contact. Some allergic reactions are triggered when an allergen touches the skin. This leads to a condition called allergic contact dermatitis. Common culprits include metals like nickel, often found in jewelry and belt buckles, fragrances in perfumes and lotions, hair dyes, and certain plants like poison ivy. The reaction is usually confined to the area of skin that came into contact with the allergen, resulting in a red, itchy, bumpy rash that can sometimes blister. This type of reaction is usually delayed, appearing 24 to 72 hours after exposure, which we will explore later. Finally, the fourth route is injection. This is when an allergen is introduced directly into the bloodstream or tissues. The most common examples are insect stings, where venom is injected under the skin, and certain medications that are given via injection or intravenously. Because this route bypasses the body's initial barriers and delivers the allergen directly into the circulation, it can lead to a very rapid and severe systemic reaction. This is why allergies to bee stings or injectable drugs like penicillin are particularly dangerous and have a high risk of causing life-threatening anaphylaxis. Now we're going to level up our understanding and talk about the broader concept of hypersensitivity reactions. An allergy is a type of hypersensitivity, but the term actually encompasses a much wider range of immune system malfunctions. Essentially, a hypersensitivity reaction is an undesirable, exaggerated, or inappropriate immune response to an antigen. This antigen can be an external one, like pollen or a drug, or it can be an internal one, where the immune system mistakenly attacks the body's own cells or tissues, leading to autoimmune disease. Traditionally, these reactions were classified into four types by doctors Coombs and Gell back in the 1960s. This classification is based on the mechanism of injury, that is, which parts of the immune system are involved and how they cause damage. However, modern immunology now often includes a fifth type to account for a specific mechanism seen in certain autoimmune diseases. For your exams and your clinical practice, it's essential to know all five. We'll break them down one by one, but first, Let's group them into two main categories to make them easier to remember. The first broad category is antibody-mediated hypersensitivity. This group includes types 1, 2, 3, and 5. As the name suggests, the key players in these reactions are antibodies, those Y-shaped proteins produced by your B cells. Different types of antibodies are involved in each reaction, and they cause damage in different ways. In some cases, they trigger the release of chemicals like histamine, as in type 1, while in others, they mark your own cells for destruction, like in type 2, form damaging clumps that get stuck in your tissues in type 3, or wrongly stimulate a receptor in type 5. The reaction time for these can be really fast, from minutes to hours. The second category is cell-mediated hypersensitivity. This group contains only one type, type 4. This reaction is fundamentally different because it doesn't involve antibodies at all. Instead, the damage is caused directly by immune cells, specifically T cells. There are two main kinds of T cells involved: helper T cells, which recruit and activate other immune cells called macrophages, and cytotoxic T cells, which can kill targeted body cells directly. Because it takes time for these T cells to be activated and travel to the site of the antigen, this type of reaction is often called delayed type hypersensitivity, with symptoms typically appearing 24 to 72 hours after exposure. Let's dive into the specifics, starting with type 1 hypersensitivity. This is the classic allergic reaction we've been discussing. It's also known as an immediate or anaphylactic hypersensitivity. The key player here is the IgE antibody. As we covered, upon first exposure to an allergen, the body produces specific IgE antibodies that coat mast cells and basophils. On subsequent exposure, the allergen cross-links these IgE molecules, triggering the mast cells to degranulate and release histamine and other inflammatory mediators. This process is incredibly fast, with symptoms appearing within minutes of exposure. The clinical examples of type 1 reactions are the ones you're most familiar with. This includes the vast majority of common allergies: hay fever, which is allergic rhinitis, allergic asthma, food allergies, and the most severe manifestation, anaphylaxis. Anaphylaxis is a systemic type 1 reaction where massive, body-wide histamine release causes widespread vasodilation, leading to a catastrophic drop in blood pressure or shock and bronchoconstriction, which means severe difficulty breathing. It's a true medical emergency that requires immediate administration of adrenaline, also called epinephrine, to counteract these effects. Now for type 2 hypersensitivity. This is also called cytotoxic hypersensitivity. In this reaction, the antibodies involved are IgG or IgM. These antibodies mistakenly bind to antigens that are located on the surface of the body's own cells. This binding essentially flags the cell as a target for destruction. The immune system then destroys the cell through one of two main mechanisms. First, the antibody-coated cell can be engulfed and eaten by phagocytic cells like macrophages. Second, the antibodies can activate the complement system, which is a cascade of proteins that punches holes in the cell membrane, causing it to burst. A classic example of a type 2 reaction is a mismatched blood transfusion. If a person with type A blood who has anti-B antibodies is given type B blood, their anti-B antibodies will bind to the surface of the transfused red blood cells. This triggers a massive and rapid destruction of those red blood cells, a process called hemolysis, which can lead to fever, shock, and kidney failure. Other examples include certain drug-induced hemolytic anemias, where a drug attaches to red blood cells and causes the immune system to attack them, and autoimmune conditions like Good-Pastures syndrome, where antibodies attack the basement membranes in the kidneys and lungs. Moving on to type 3 hypersensitivity, also known as immune complex-mediated hypersensitivity. Like type 2, this reaction involves IgG or IgM antibodies. However, instead of binding to antigens on a cell surface, the antibodies bind to soluble antigens that are floating freely in the blood or tissues. This forms large numbers of antigen-antibody complexes. In a normal immune response, these complexes are efficiently cleared away by phagocytic cells. But in a type 3 reaction, they are formed in such large quantities that they overwhelm the clearance system. These excess immune complexes then get deposited in the walls of small blood vessels in various tissues, such as the kidneys, joints, and skin. Once deposited, these complexes trigger an inflammatory response by activating the complement system. This attracts neutrophils to the area, which then release their damaging enzymes in a frustrated attempt to engulf the trapped complexes. This leads to inflammation of the blood vessels, called vasculitis, and tissue damage. A classic example is serum sickness, which can occur after receiving certain medications or antivenoms. Autoimmune diseases like systemic lupus, erythematosus, and post-streptococcal glomerulonephritis are also prime examples of type 3 reactions. Next is type 4 hypersensitivity, the odd one out. This is the delayed type hypersensitivity we mentioned earlier, and it is purely cell-mediated, with no antibody involvement. The main players are T cells. Upon initial exposure, specific T cells are sensitized to the antigen. On subsequent exposure, these sensitized T cells become activated. Helper T cells release cytokines that recruit and activate macrophages, leading to inflammation and tissue damage. Cytotoxic T cells can directly kill tissue cells that are displaying the antigen. Because this process of T cell migration and activation takes time, the reaction is delayed, typically peaking 48 to 72 hours after exposure. The classic example of a type 4 reaction is the Mantoux test for tuberculosis, where a small amount of TB antigen is injected into the skin and a localized hardened red swelling indicates a positive or sensitized result. Allergic contact dermatitis, the rash you get from poison ivy or a nickel allergy, is another perfect example. The chemicals from the plant or metal bind to skin proteins, and this altered protein is then targeted by T cells. This mechanism is also at the heart of conditions like the autoimmune disease type 1 diabetes, where T cells systematically destroy the insulin-producing beta cells of the pancreas. Finally, we have the more recently added type 5 hypersensitivity, also known as stimulatory hypersensitivity. This is really a subtype of type 2, but it's distinct enough to warrant its own category. Like type 2, it involves antibodies binding to cell surface receptors. However, instead of marking the cell for destruction, the antibodies in a type 5 reaction actually mimic the natural ligand for that receptor and stimulate it. So, instead of blocking or destroying, the antibody inappropriately activates the cell, causing it to overproduce whatever it is supposed to be making. The quintessential example of a type 5 reaction is Graves' disease, a common cause of hyperthyroidism. In this autoimmune condition, the body produces antibodies that bind to and activate the thyroid-stimulating hormone receptor on thyroid cells. This tricks the thyroid gland into thinking it's constantly being stimulated by TSH from the pituitary gland. As a result, the thyroid goes into overdrive, producing an excessive amount of thyroid hormone. This leads to symptoms like a rapid heart rate, weight loss, anxiety, and bulging eyes. It's a fascinating example of the immune system not just attacking, but hijacking normal bodily functions. So there you have it, a comprehensive but, I hope, straightforward guide to the world of allergies and hypersensitivity reactions. We've journeyed from the simple sneeze of hay fever all the way to the complex cellular warfare of autoimmune disease. We've seen how the immune system, our greatest defender, can sometimes get its signals crossed and launch a powerful attack against a harmless substance, or even against our own bodies. Understanding these mechanisms is not just academic. It's fundamental to being a compassionate and effective healthcare provider. It helps you understand why a patient's eyes are itching, why they can't breathe, or why their joints are in pain. We broke down what an allergy is, an overzealous IgE-mediated response, and looked at common conditions like hay fever, asthma, and eczema. We identified the main culprits, the allergens, and traced their four main routes into the body: inhalation, ingestion, contact, and injection. Knowing these pathways is key to diagnostics and patient education. Then we delved into the Coombs and Gell classification, expanding it to include the 5 modern types of hypersensitivity, each with its own unique immunological fingerprint, from the immediate IgE-driven type 1 to the delayed T-cell-mediated type 4 and the stimulatory antibodies of type 5. Remember, These concepts are the building blocks for so much of what you will see in medicine, nursing, and other health professions. From pharmacology to rheumatology, and from dermatology to emergency medicine, a solid grasp of hypersensitivity will serve you well. Review the diagrams, reread the examples, and try to draw out the pathways for yourself. The more you engage with this material, the more it will stick. This isn't about rote memorization, it's about building a mental model of how the immune system works, both when it's functioning correctly and when it goes awry. I hope this has been helpful and has cleared up some of the confusion around this topic. If you found this video useful and want more deep dives into core medical concepts, explained simply and clearly, then make sure you hit that subscribe button for Joen Academy. We're constantly working on new content to help you succeed on your journey to becoming a healthcare professional. Drop a comment below if you have any questions or if there's another topic you'd like us to cover. Thanks for watching, stay curious, and I'll see you in the next video.